believe that Africa's public health sector isn't just about saving lives. I know you believe that too. There is an economic angle to it. The health sector is fueling our economies across nations. In this episode, I sit with a man who is very knowledgeable in the public health sector. He wears two hats. He's a public health expert. He is a climate change expert as well. Victus Sabutey is an amazing brain in the Africa health space. And we discuss what exactly are we doing right? What are we doing wrong? What can we learn from the things that we are doing right? And what can we learn from the things that we are not quite getting? And bring all that knowledge together and advance as a continent. So join us on this episode of Fields of Alkebulan, the podcast, as we delve into the health as wealth episode. So it's another episode of Fields of Alkebulan. Today, my guest is a public health specialist, a climate health innovator, a media strategist, and a PMP candidate. That's project management candidate. I'm so curious. After all that he's achieved academically, he's still pursuing higher learning. So today, my guest is Victus Sabutey. And Victus is an old, dear friend of mine. Victus is a friend, a former colleague in the media space. He's a big man now. He's a very big man now. So I'll give him the opportunity to tell us what he does, and then we can start from there. What do you do, Victor? I've said all these things: public health specialist, climate health innovator, media strategist. But what are the organizations you've worked with? What are the organizations you're working with? What are you doing now?
Oh. First of all, thanks so much for inviting me. And it's been years.
It's been ages.
Yes, and good to see you. You're still vibrant as you used to be.
Awesome. That's good to hear. I thought I lost the vibes.
Never. Right. You asked me a very big question, $1 million question.
Mhm.
What am I doing now? It's a big question. So currently, I work with the British High Commission, specifically with the Department for Environment, Food and Rural Affairs, serving as their Animal Health Senior Project.
Animal Health
Yes.
Senior Project Officer. Okay, that's interesting.
Yeah, for Ghana. On one of the, so we currently working mainly on Ghana's animal health system strengthening, supporting government of Ghana in that direction, with the help of my leads in that sector. So that's what currently occupies me. So either I'm in country here or I jet off to in the UK or back in country or elsewhere to advance the same cause.
You must be a busy man.
Well, we are managing, as politicians will put it, we are managing it. So previously, I've worked with Creative Storm Network.
Yes.
Should I say for about 11 years?
Yes.
Yeah.
Yes. We collaborated on a number of things whilst you were there. Yes.
And so it's a multimedia organization development center where I serve as the research and productions coordinator.
Yes.
Specifically in the areas of health programming, environment programming, education, governance, and so forth. So in the past, many people will have seen things around Maternal Health Channel.
Yes, I remember
series.
that. Yes.
They would have seen Ghana Police Watch. They would have seen the Environment Channel across board, and they would have seen a lot of riveting documentaries,
Yes.
development focus for most of our development organizations. I've been a brain behind that.
Yes, and we loved. I mean, I loved the maternal channel. It made such great impact.
Yeah.
Even the campaign for the police watch.
Yes.
And I mean, all these campaigns that you spearheaded, they made a lot of great impact in our space. I mean, the Ghanaian space. So I'm happy that you've gone even beyond Ghana. Your work is affecting the rest of Africa now, and it can only get better, right?
Absolutely.
Yes.
Absolutely.
You, Victus, I mean, on a lot of platforms, you focus on health, climate change, and all that. You have called health Africa's most overlooked GDP driver.
Yeah.
Why do you say so, and can you prove it? I mean, someone might argue with you that that's not accurate, but can you prove this with numbers?
Yes. So, this was then, and it's still the same now. It hasn't changed, especially within our context here in Africa. So it's a big GDP driver. So if you look at our current health contribution to GDP across board, it's estimated to be around 1 billion, or more annually. In some instances, it's for the whole of Africa, we are looking at things to 10 billion or more, right? Now, why do I say it's overlooked? Because it's one of the sector that hasn't seen much investment.
Health.
Yes. You may think a lot of investment has gone there, but not so. Take, for example, if you should invest about, there was some modeling that was done, right? The modeling that was done, which we still hook to, that suggests that if you invest about $40 billion in our health sector within the next 5 years, that can reap you over 200%, looking at about $600 billion. And I'm not so surprised, because currently there is this US billionaire, a woman, of course. What she's doing is to even invest.
It will help to know her name.
Yes, I'll figure out the name.
Okay, sure. That's fine. That's all right.
Investing less than $40 billion in putting up a medical school in the US. That is going to focus on the rural folks much more. And per her projection, within 5 years, she'll get the money back. So you can imagine, if our states decide to pump in a lot of money in there, it will contribute a lot to our GDP. And I'm using that as a whole.
Health overall. But if I am to just looking around, you see that there was a time in our space, in Ghana, there was a time you would find a family. If you needed to go to a pharmacy, it's not really close to you, right?
Yes.
But now you go into a community and you can find 5, 6 chemical shops, pharmacies that are competing with each other in that small community. That's some investments, private investments that's going into the pharmaceutical space, because people know they are reaping the benefits financially. And so if you say there is no or little investment, I don't know what you're talking about, because people are investing.
Yeah. So the thing is around affordability. People are investing in those spaces, but are citizens able to afford?
Okay.
Let me break it down for you.
Okay.
It's good you even mentioned the medicine counter or the pharmacies and all those aspects.
Yes.
My master's in public health, I focus it on malaria test, treat, and track, where I made it. My focus was on these pharmacies within the Volta region, Southern Belt. And you could see you have a lot of them there. You just have them in picture, but they're not really making the gains when you go down, detail down the figure for them. Now, bring it to the national level. You see that people are making some effort to invest in the health space, be it health facilities and all those things. It boils down to an issue of affordability now. Look at the University of Ghana Medical Center. How many people can afford that for comprehensive healthcare? Right. I took my son there recently, and if not because of insurance cover, maybe my pockets will have dry by now. If you go to Ridge, Kolebu, and all those things, that's exactly the same thing that they are facing. And I'm sure along the way, I'll explain how, from the legal point of view, I will explain that to you as to the cost-benefit analysis of having all those things. But again, the citizens are not able to benefit from that. So there's been some form of, should I say, advancement, development, investment within the space. But the return, its contribution to GDP is very, very small.
It's smaller.
Yeah.
Oh wow. Oh wow. Okay. We'll get into how we can manage to we'll get into how we can overturn that situation.
Absolutely.
But I want to find out, beyond public health, you are also climate change expert. If we are to link climate and health, is that the future for African public health financing?
Right. So I will say yes, and I will explain that to you with a caveat. Yes, because now climate change underpins everything that is happening, even within the animal health space. If you look at our coastal communities, using Keta as an example, Ada and
Keta being, because we have a global audience,
right,
and people are watching us from across the continent. Keta is in the Volta, region of Ghana.
Yeah, and much more closer to Togo side of things, from where we sit.
Yes.
It is being impacted by climate change, specifically sea erosion and all that. And the whole town is virtually gone.
It's swallowed up.
It's swallowed up by the sea.
By the water, yes.
Right. So I usually say people who are having land litigation issues now, they have to go into the sea and still fight for their lands. That's just
you probably have to fight the sea for your land.
But the real fight is between the health and the climate change component. Why so? It has brought about a lot of climate sensitive diseases impacting us, especially children under 5, pregnant women, and so forth. So we used to have malaria and all those cases and all that. Because of the change in climate and all that, there has been kind of a shift, or we don't want to call it adaptation, but mutation across board that is affecting health.
Okay.
And to that extent, it has also increased the budget and cost that you have to spend when it comes to health seeking as a result of climate change.
Yeah.
Now, climate change is not prioritized. Health is not prioritized mainly under climate change, even to the global level, until recently, COP 2029, when we now have a permanent seat where health issues can be discussed.
Okay.
Previously, you only see environmentalists and finance or
at the table,
making issue.
But everybody forgot that the health impact of what is happening is also dire.
Absolutely.
Yes.
And health financing relating to climate change is just about 0.5%.
Okay.
And the rest take over everything. But that is why currently, for development partners and all the system strength meetings that you see, if it is not informed by climate change, you will not seek you not even get to the table for it to be discussed. So Ghana's animal health sector, environment side of things, even educational programming, if it's not informed by climate change, the impact of climate change on that, funding is not there. And there is a lot of funding within the climate change space.
Okay.
The challenge is, especially Ghana, how to put your data together to attract those funding. But the fund is there across board. And
what is the hindrance? I mean, in the data collection sense, what exactly do you figure is because I mean data is data. You put yourself to work and you gather it. What is the problem, you think?
So within our space here in let's say Ghana as an example, we don't have the infrastructure to collect climate sensitive data. Right? We can collect normal data relating to rainfall patterns and all those stuff. But to paint a fuller picture, the impact of climate change in a specific area is not there. Difficult to get. But for you to secure that funding, it must be backed by accurate data, where we lack the infrastructure to do that.
We lack the infrastructure, but can we partner? I mean, so we are talking about Ghana now. Are there other countries on the continent that have that infrastructure or elsewhere that we can partner with? Have you identified in all the conversations you've been in at the global level and in all the activities you have partaken in the project, can you identify countries that we can probably partner with just to collect this data and move on?
Yes, I think within Africa, South Africa is doing something good in terms of their data. From research, I also understand Gambia is also doing something interesting in terms of gathering data. In recent times, I also understand Ghana is picking up, but we need to do a lot more to even catch up with where our African peers are at the moment. So the collaboration can happen, but can happen at that level. So for example, the coastal erosion project, University of Ghana was partnering with Denmark, universities in Denmark, to model things around, because we don't have the exact data. But to do modeling, to do projections as to what can happen if A is this, B is this, what can become of C, and so forth and so on in terms of our climate. So the opportunities are there globally to partner. Within Africa, same, but it may not give you the certitude that you need. Yeah, but it puts you at a better position to attract the necessary funding that you want.
Fantastic. I'm happy to hear that because it's necessary. If you cannot or if you're not able to do it, you should. I mean, we are all on the motherland, on the same continent. It is Africa, Alkebulan. We serve each other better. And I mean, we serve the collective better if we collaborate. So if a sister nation is unable to figure things out, I mean, we should be able to reach out to you, and you should be able to, be willing to help on that front, right? That's the only way we can advance as a continent. Now, let's talk about your project management. Your project management certification. Why should health professionals care about project management frameworks?
If I have my way, everyone should read project management and be certified. In fact, the professional way.
You mean everyone in the health space?
Not only within the health space, across board.
All industries.
All industries. Now, focusing it in the area of health space. Why should they?
Yes.
Now, right. Health is moving at a lightning speed at the moment. Where we have telehealth and so forth and so on. That requires that you need to be agile in whatever you do. time-sensitive response, time-sensitive feedback,
Okay.
and all that. And in a situation where we have scarce resources, where international finance is also dwindling, where development partners have also cut down on their
Funding.
almost by 70 to 80% across board, you need project management specialists to help you restructure your work and reposition it to make use of the scarce resources that is available.
But do we really, okay, let me not take the wind out of your sail. You conclude your thoughts because I have a question. So conclude your thoughts and then let's see.
To be able to manage the scarce resources that you have and respond timeously to the ever-pressing demands within the health sector, which ordinarily, if you don't go through the agile systems that is within project management, you cannot tune your mind to that. So let's take a very basic one as an example. If a disease should break out now, and our leaders want to make decision, they will have to now start writing letters to all the key stakeholders to now book a time, come have their seats, and now talk about it. At that same time, the disease is
spreading.
But anyone who goes through that project management system, in fact, for example, the agile system, as an example, once the team breaks, it's just a matter of calling. Everyone will come. There is no seat. You all stand up, prefer ideas, quickly decide what's supposed to be done, moving immediately.
So it is the discipline that it instills in the professionals that makes it extremely important.
And it has some protocols as well that needs to be followed to make it agile. Right.
All right. Awesome. But you see, when we talk about anything these days, as far as certifications are concerned, and in fact, in any field, any industry, the huge disruptor is AI. Do we need a project management professional when AI can put what you said, that, leaders would put together professionals, they sit at the table, and they discuss. By the time they are done discussing, the disease has spread. The disease has spread. I don't want to even, let me add the coffee breaks and the lunch breaks that they may indulge themselves in the process. So by the time they are done, there's like the whole thing has spread like wildfire, and then they would be playing catch up. But there's AI. There's AI that is faster than the PMP professional. So what is that agility?
So that AI needs a prompt. That prompt must come from a project management professional who recognize the fact that I need to key in something within this AI to act for me.
Awesome. So it won't be junk in, junk out. I totally. So
if that person is not trained, well disciplined first in that area, will not even recognize that this is an emergency.
Awesome.
And this is the tool that you're supposed to deploy. Whether you need to deploy the waterlog system or the agile system or what so forth that you want to deploy. So is that training, is that discipline that is required to make it work?
All right. Well, I'm convinced. We take a break and then we circle back. I've been wanting to ask this. You are World Bank Master Trainer on climate change. Fantastic. I've heard you on a number of, and even now, you are drawing the link between climate change and health. What is the one connection, and in the climate health situation? What is the one connection that policymakers miss? Like, just what are they not getting about the link between climate change and health?
So it's again $1 million question. Sometimes we also talk about the politics of climate change.
Politics of climate
Right.
change.
And of course, in fact, I read political science too.
Okay.
My longest essay was on the politics of climate change
Okay.
as well. But that was way back.
Okay.
Right. But what are they underestimating? Basically, it is in the area of how climate change amplifies infectious disease risk.
Okay.
Let me give you an example within the Ghanaian context.
Okay.
Right. So diseases like malaria,
Okay.
diarrhea, meningitis, and all those things are influenced or informed by weather conditions as well. So malaria can increase due to environmental factors. Previously, we were not having much cases of malaria, let's say in the eastern regions, parts of Ghana, for example, Ebri and its catchment areas. But now, because of climate change amplifying that risk, we are seeing that a lot, even in Ebri areas.
Okay.
That again puts a lot of strains on the Ghana health system and the infrastructure. And because climate change is negatively impacting on these infectious diseases, among others, we don't have a resilient infrastructure that can back it for our health system to be more resilient to some of these things.
Okay.
So most of our policymakers, most of our leaders, kind of either they understand and they know, or they are underestimating the impact of climate change on this sensitive.
Are you privy to information, or do you have any insights into efforts being made to bring their attention to what they are missing?
Absolutely, yes. That is why, one, deliberately, most of the ODA support, that is official development assistance from most of the development partners, is being informed by some specific thematic areas. So if a support is coming to Ghana or any other African country as an example, it will require that the country or the policymakers should have capacity in the area of A, B, C, D. Key among them is climate change and how that impacts in the sector that perhaps you are seeking that support from.
Okay.
So that is being done at the development partners level in that way. Now, there are also fundings to support PhD, master's programs, and some short courses for our policymakers in these sectors, so they can fully be abreast with some of these information and integrate them into their daily work as well. So at that level, that is happening. And I mean, there are a lot of TV programmings and a lot of write-ups around that. And most of the projects that are also be funded, for example, physical projects, there must be climate sensitive impact and all that done. And that requires that there must be some capacity within that space, or there must be some education within that space before that can happen. Yeah.
Okay. So there are media wars for public health. And I remember we talked about this at the start of the interview. Some of the things you have done before, assuming the roles that you are in now. Before that, you were with the Creative Storm and you had a lot of campaigns. One of those campaigns that really caught on was the Ghana Police Watch. Is that what it was called?
Yes, Ghana Police Watch.
Awesome.
Yeah.
So are there, I mean, that campaign was spot on.
Yeah.
And a lot of people enjoyed the videos that came out of that campaign. and I enjoyed most of it.
Right.
Are there things that we can learn or pick from such a campaign and adopt it in the public health space? I mean, it was a very effective campaign, wasn't it?
Yes.
Yes. I mean, what are the things we can do in the public health space? How can we get a better campaign running for public health that would help all of us?
That's a very good question and a very good observation you've made. And I think you guys have made it very successful.
Oh, we made it. The viewers.
Yes. We are the same.
Yeah.
One thing that comes to mind is, crime, when it comes to crime, is an issue of surveillance.
Okay.
We hear of surveillance too within the health system, but they have within crime, they have a very effective crime check surveillance system that is mounted to ensure that they foil all manner of crimes that is going to happen.
Okay.
And I was reading today that some people were going to rob a bank in one of the towns in Ghana, Winneba, and the police were able to foil that. It takes surveillance to do that. Bringing that into our health system. The challenge we have in our health system right now is that we don't have an effective surveillance system. Those that are there are also not interoperable.
Okay.
So you have some surveillance work ongoing within the animal health space,
Okay.
within the human health space,
Okay.
within the environment sector.
All right.
But that one health and bringing all of them together,
integrating it,
and making it real time is not there.
Okay.
That is why we suffered the impact of COVID. Let me break this down for you. So should we have had a very effective or interoperable system, we would have picked the signal much earlier around the COVID-19. It will shock you to know that most of the diseases that are affecting you and I today are basically zoonotic in nature. What it means is that it's from the animal health space.
Okay.
So you will talk about mpox.
Yes.
You talk about COVID.
Yes.
There are a lot of debates around that.
Okay.
You talk about a lot of them.
Because I was about asking COVID. How did it start? Where did it start from? Which animal? I mean, we've heard all kinds of things. Somewhere in China and all of that. But
absolutely,
there is a viewpoint now you want to share with us. Because I would go into your work on COVID with you partner with the UNFPA to do some work in COVID. But let's conclude this other thoughts and then we can move on to that.
75% of those emerging diseases now are from the animal health space.
Okay.
Now, if we have a good surveillance system, which is interoperable, running very well, we'll be able to immediately detect, diagnose, and then even prevent. So now the whole focus is around being able to detect, respond, and even prevent. So that is one thing we can borrow from the crime side of things, bringing into health. But it calls for very important meetings, key stakeholders agreeing, sharing information, which they don't want to do and they don't like to do. Because information is $1 million thing. Now, if you share all your information with me right now, I'll take over your space. And you will become irrelevant.
No, but AI is making everyone irrelevant anyway. So why are you holding on to what kind of power, what kind of control do you think you still have when humans cannot collaborate against the machine? Because if you are holding on to the information, if you sit at the table, you share information, you agree that this information, we want to make it work. This thing, we want to make it work. The reason we are sharing information is to ensure that we have a better system for the people in our lands, for the people in our nations, in our countries. If that is the mentality going or sitting at the table, You can't collaborate. I mean, information is power, and I get it. Okay. People hold on to it because then it gives them the control over a system.
Yep.
But all systems are now crumbling under artificial intelligence. So that information you think you know and you're holding on to because the other person at the table doesn't know what you know. AI knows it, and AI has been trained to even improve on that information. That makes you irrelevant. So how about we think, reflect, and decide that as humans, whatever information we have, let us work together, let us collaborate and make things work for ourselves. Because there is a time that, many people argue that a time will come where the machines are fighting us, we are fighting the robots, you know. Yeah, so I mean, what is stopping us? What is stopping us?
Let me give you a clear example, and I'm sure this will be shaking some tables.
Okay.
Right. So
let's shake some tables.
Take our animal health space and human health space. We have the Veterinary Services Directorate. We have Ghana Standard Authority, Food and Drugs Authority, and so forth. They all need to work together collaboratively to benefit you and I. Right. Now, when it comes to certification of foods of animal origin, there is a big fight there. Whether it should be veterinary services that should certify for us to eat, or the Foods and Drugs Authority should certify that for us to eat. There is a big fight there, and each of them are holding on to their territory. Don't want to share the critical information or partner, because at the end, if I am certifying, I'm generating revenue into my organization.
Okay.
If you are the one also certifying, you are generating revenue into your organization based on that information that you have. At the end, you and I are suffering.
I was just about saying that at the end of the day,
yes,
nobody gets to win.
That's right.
And some robots would win.
Robots will win. And that robot is generating money into a single individual.
Yes.
That's why we have tech billionaires.
Yes.
And it will keep increasing.
Yes.
A lot will be wallowing in poverty. In fact, World Bank term, urgent poverty.
How do we make people get it? Because we need to get it. We need to get it well enough to know that there is work to do.
Yeah.
And we must do it well. And we must be willing, we must open ourselves up to what is coming.
The thing is, for me, it boils down to one, leadership and legislation. So you bring in the leadership, ensure that all parties understand what they're supposed to do, and you legislate. You'll be shocked to know that within our health system in general, and for that matter, the animal health space, Ghana does not have clear law or act. We don't have an animal health act assistance now. So everyone is doing whatever they want.
That's why you find the animals on the streets everywhere.
Yes.
I mean, all kinds.
Yeah.
In the past, it used to be, that's the communities we had, and they paid attention. I mean, when in our villages, communities, they paid attention to the animals.
Yes.
In a way that if there was an animal that was unwell, they would quickly isolate that animal. The community had a way of doing it. Now with development, these things have reduced, and the surveillance, the attention we give to these animals, it's reduced. And so now I could be here and I see an animal crossing from one end to the other. That animal could be sick, would leave one community, go into another community, make the people sick, and then it just keeps giving. It just keeps giving.
That's exactly it. You just said it right. That's why we are suffering, and we'll keep suffering. And so we have bylaws to cater for some of those things.
But there's
But
no
the leadership
specific.
is not also delivery in that space. So we are losing from the leadership side, and we're also losing because we don't have time-tested legislation.
You look and you see that you don't have much health content, even from individual content creators. I mean, not to talk of health facilities themselves. I mean, there's a lot of content online, different kinds of content. Some content I really don't like. I mean, it's not bringing us anything. Everyone, if you open your TikTok, everyone is having a makeup tutorial. Like 90% of my TikTok is like makeup tutorial, some other stuff I don't want to mention, really. But we don't have the things that would help us, improve us, and move us forward. Where is the health content? How are you, people like you, working to drive the health content?
Right. So you see, some things don't sell, but they are the critical things that we need. Health is not selling. Health campaigns and messaging is not selling, and it's not appealing on some of those platforms as well, because we have made it so. Now, the point needs to be made that, and also using COVID as an example. When COVID broke out, there was a lot of misinformation, and those ones sell the most across board. So on TikTok, and not to say TikTok is not good, it's a very useful platform.
Yeah, useful.
Most of the things that are selling is beauty, and some others that are not media friendly that we should
to
mention
speak
at
of,
the
yes.
moment. So when you go to put a health program in there, it suffers. Coupled with that, most of our health content and programming or campaigns are not dubbed in the language that the people best understand and can express themselves.
Okay.
So Africa, for example, we have close to about 2,000 languages.
Okay.
But you realize that most of our programs are either in English, French, or the top languages as we so made them to be. So a lot of people who are not socialized with these kind of languages cannot understand the program and make use of them, the content. And so they are also not selling out on those platforms. And people have most of these social media platforms, but what do they use it for? It's when they are stressed. They just want to go there and distress.
Okay.
So when you come to them with a very critical information, it doesn't make sense.
No, but this critical information, I mean, these things can be created in a way that is also relaxing. Do you understand?
Yes.
That's why we have storytellers. That's why we have creatives.
Yeah.
Creatives find a way around the hard stuff, make it soft, and push it into the system.
In fact, that's the point I'm coming to
Okay.
now. That if we decide that we want to train most of our content creators in development-based content generation or creation and so forth and so on, and take it from the angle of health programming, we can change because the agenda is led by them. It is what is put out there that the people feed on. So if we decide that we train these people, we empower them and tax them to do A, B, C, and D campaigns on health and so forth and so on, they will be able to do that. They'll be able to transform lives. Behaviors will be changed across board, and we can see the impact of that across board. But if we leave it out there, everyone is doing what they so wish to do, that is what we'll definitely get. So it boils down to, I don't want to call it state regulation, but a bit of regulation and tailored messaging. And we can ensure that, our health system adopt AI the use of social media platform, for example, as you referring to TikTok, as an example, to reach out to people.
Okay.
But make it very catchy, time sensitive, the time to push it out there, catchy in the sense of attention grabbing, and also making it's more kind of fun in nature, so that people can relate to it within their context, and then the message will be communicated.
I mean, it's important. It's important because, to be fair, there are some health content out there, to be fair, but it's not much. A few people come up with herbal, natural medicine and these things that we now overlook, and a few of them are putting it out there, and some of us would go and watch because we are learning things we should know. We are going back as Africans. We are now going back to learn these things, but there can be more. And I dare say that I know you have all kinds of fancy degrees in health. You even have a law degree in health, public health, right?
So I have masters in public health, health policy side of things, and I also have masters in health law.
Yes.
And the ethics.
Fantastic. I mean, so with all the exposure, maybe someone like you might not even advocate for traditional. Would you advocate for traditional medicine? Of course, yes.
I'm an advocate for that. The standardized ones.
Yes.
That are good.
Yes.
And you know the ones that are selling most?
Tell me.
The one that will make you very potent.
I didn't see that coming. Awesome, yes.
Right.
Yeah.
You see, that one sells.
It does. It does. Yeah, sex sells, right?
Yes.
So, well, yeah, of
Rather
course.
than me coming to tell you malaria, when you suspect you have malaria, you need to go to a recognized health facility where you go through the 3 T's. That is, you'll be tested, you'll be treated with quality assured anti-malaria drug. And after that, when you feel okay, you go back to the health facility where you'll be tracked. That will not sell to you rather than the other ones.
Yeah. Your health law degree. There is this dirty open secret about IP laws. Can we talk about it?
Yes, we can.
IP laws, are they killing more Africans than they are to help?
In fact, that's a very powerful and provocative question.
Explain IP laws for our viewers and listeners who don't know.
So it's basically, IP laws basically talk about intellectual property laws in that sense. And what does that mean, intellectual property? So if, let's take, for example, the discussion that we're having here, you own it, right? And whatever I am saying, it is what I say, and I own that. That's an example. So as a country, for example, we may have some specific rights to some medicines and so forth and so on. And we have the intellectual property. It is our property. We use our intellect
to produce
that. So it belongs to us. So we protect it jealously because we want to, for example, make money out of it. To your question, is that killing us?
More than diseases are.
More than diseases are.
Yes. I mean, the health space.
Yeah.
Yes.
There is a whole debate around that.
Okay.
To a greater extent, people will agree that that's equally killing. Let me give you an example, even down to the COVID times.
Okay.
You bear with me that at a point when COVID was rising, and we found the vaccine for COVID.
Yeah.
The countries that found the vaccine, the solution to COVID, decided that they will not export it.
Oh, okay.
They'll concentrate it in their countries.
Okay.
So they were buying it from the company that was producing it because they say the country owns it. That is one. So Africans were suffering, if not because of Gavi and all those alliances that international bodies that went in and also buy those vaccines on behalf of the less privileged countries, COVID would have been even worse. They were protecting theirs at the expense of the generality of the world. So we were dying. And they were protecting themselves.
And that brings us to the bigger conversation. Why should we be dying in such a situation? Why are we in a place, in a state where we can't do anything for ourselves? When there was a time that Africa led civilization. There was a time that Africa was the brain behind many of what we see across the world. We have a lot in our lands, even the people, the intellect of the people. We seem to be sitting down on our abilities for other nations and other continents this COVID thing, we have health experts, we have people in Africans who are even working in those nations who are bringing up great ideas. How is it that we would be at the suffering end of such an incident?
At the bottom side or at the heart of intellectual property is profit making. Now, this is how it affects us. So when you have an intellectual property to something, you want to gain from that a lot. Within the health sector, people are holding on to some of these intellectual property and rights to the extent that they are using it to develop their countries. Ghana, for example, we now have the University of Ghana Medical Center, which is a higher degree of a tertiary facility, right? We are holding on to some rights, and we are using that to develop the country from tourism point of view, health tourism. Our sister nations are bringing complicated cases right here. And when they come, it's part of health tourism, and we are getting a lot of money out of that. Aside that, it is also used to control cost or pricing to some extent. You might have read recently that there is an HIV vaccine or drug that is out there now, and is costing about $28,000 per year. That is hoping, if I'm not mistaken, about 300 and something thousand Ghana cedis a year. How many people can afford that? So it is at the heart of it, institutions, individuals, and states trying to make a lot of gains out of that intellect before they release it out. When it becomes sometimes no longer useful, other sister remedies have been,
You are someone who has worked at the grassroots level. You've done a lot of work in communities. I mean, communities in Ghana, communities across the continent. And you have a wealth of knowledge in all these things that we need to pay attention as a people. Africa is rising. Africa is waking up. We are no longer a giant asleep. Okay, we are no longer a giant on snooze. We are waking up. And in our belly is so many, I mean, the belly of these giants called Africa is so much wealth of knowledge and even physical wealth, but the people, what you know, what you do, we can capitalize on all of this knowledge that you have, for instance, and do greater things for ourselves as a continent. So we need to talk again. You have to come in many times. You have to have like several repeats of this conversation because there are a lot of things I wanted us to cover, but the time would not permit us. So we'll have to do this again, Victus. I was so glad having you. It's been interesting sharing with you from your wealth, from your assistant of knowledge, and I want us to do this again. So yes, that's it. Africa is rising, and These are some of the people who are putting in the work. You also out there, you have a lot to do, a lot to put in. And if you could just focus on your small area with your skills, the skills that you have, we can all achieve something for our continent. We've exposed the numbers, the gaps, the game-changing opportunities. We dared to shake some tables a little bit. and but here's the real question. Will Africa treat health as charity or as the backbone of its economic revolution? We are on a path as a continent. This path we are on, we are awakening the giants that we are. And as we awaken the giants that we are, what are the things that we are neglecting? What are the things that we shouldn't be neglecting in this revolutionary walk? This episode is important to share with policymakers. It's important to share with investors and young innovators. We all need to watch this episode because some of the things that Victus discusses, some of the things that Victus talks about, everyone needs to pay attention to across the board. So I'm grateful that you joined us on this episode of the Oil Fields of Alkebulan, the podcast. Till next time, let's make Africa great again.